Welcome, everyone. I'm James Zervios, Vice President and Chief Operating Officer of the Obesity Action Coalition. Did you know that more than 1 in 3 people living with obesity also have a progressive liver disease known as MASH? It's a serious issue, and today we're having a conversation about what that means for your health and the steps you can take to protect your liver. Joining us today are 2 incredible guests who bring both clinical expertise, knowledge, and personal lived experience. Dr. Jonathan Stein and Brenda Broussard. Dr. Stein, thank you for being with us.
Yeah, thank you so much for having me. It's an absolute delight to participate today, and really excited for our discussion. So thanks again.
Thank you for being here. Could you briefly describe some of your work and interactions on this topic?
Yeah, absolutely. This topic is near and dear to my heart. So I work at Penn State Health. I'm a liver transplant physician by training, and I'm actually the director of our fatty liver program. And I've spent the last 8+ years researching this condition. I spent a lot of time in the lifestyle sphere, so we really work hard to prevent our patients from progressing and requiring a life-saving liver transplantation. So our hope is through diet and exercise and precision medicine, where we tailor regimens to help people, accomplish what they want, using what makes them uniquely themselves, will be more successful and allow folks to, lead the lives they want to live.
Thank you. Thank you very much for that. And of course, Brenda, we are so glad that you're here as well. Can you share a bit about your background and why this conversation is so meaningful to you?
Well, the reason this is very meaningful for me is because for 30 years, I went to my yearly checkups, had my blood work done, did everything a patient should be doing. And 30 years ago, I was told I had, well, actually 35 years ago, I was told I had elevated liver enzymes. And they just kept saying, lose weight, did some tests, lose weight. And I did. Every time they'd say lose weight, I would lose weight. And today, though, 4 years ago, I was diagnosed with cirrhosis of the liver, managed to bring myself back down into fibrosis. And today I'm back into cirrhosis of the liver.
As we get started, tell us in the comments, for those of you that are tuning into this episode, if you or someone you know has been impacted by liver disease. Feel free to share questions at any point, and we'll try to get to as many of them as we can at the end of this fresh perspective. Dr. Stein, let's start with the basics. What exactly is MASH and how does it develop?
Sure. So, first and foremost, MASH stands for metabolic dysfunction associated steatohepatitis, which is an absolute mouthful. And, what it means is folks have abnormal metabolism, and then they get fat in their liver, and over time, this causes inflammation. And if it's not intervened on and not corrected, patients can progress and develop liver fibrosis, which means scar tissue. And then over time, if you build up enough scar tissue, you could progress to cirrhosis of the liver or even liver cancer.
Now, MASH is often referred to as a silent disease. Why do you think it goes undiagnosed so frequently?
Yeah, I think it's a very challenging diagnosis to make, even despite the fact that it's very common. And in fact, 2 out of 5 American adults, are living with abnormal amounts of liver fat. A quarter of them will have MASH. But I think there's no one hallmark symptom for our patients. And somebody's not going to come into the clinic and say, doc, I have this symptom, and I'm going to automatically think that they have, fatty liver disease or MASH. So, people tend to not, feel well across a couple different, organ systems. They may have some chronic fatigue, they may have itching, some nondescript abdominal pain, but there's really no one hallmark symptom that clues in the treating provider to really think about, MASH. It really goes back to, risk factor assessment for us. If somebody is living with being overweight or obesity, they have diabetes, they have a family history, that's really where the clinician wants to think about this. And then when we look at, population health, awareness for, MASH is very, very low. And in fact, only 1 out of 10 people, when they're diagnosed, actually even know what this condition is before their doctor tells them. So, we really have a lot more to do in terms of public health awareness if we're going to increase, knowledge base and allow our patients to even self-refer or even perhaps self-diagnose.
Now, you mentioned obesity there for a second. Why is it important for people with obesity to be screened for MASH or related liver issues?
Yeah, when somebody's living with obesity, having, MASH tends to go hand in hand. So, yeah, the same way that we store, extra body fat anywhere in our body, the liver is kind of a sponge for that. And if you're living with obesity, you are at, much greater risk to develop MASH over time. And really, this goes back to the hallmark of what drives both conditions, and it's having abnormal metabolism, not processing sugars or insulin well, and then over time we see just increased deposits of fat throughout the body, including in the liver.
What are some of the key steps that people can take to prevent or even slow the progression of MASH?
Yeah, I think it starts with awareness. So just becoming educated about the condition is very important. But when we look at what we can do on a one-on-one basis, what can I wake up and what can I control? A lot of it starts with lifestyle. So by becoming more physically active, we typically recommend about 150 minutes per week of moderate intensity physical activity, and this equates to taking 20 extra minutes of activity a day, and that reduces your risk of MASLD and MASH by about 20%. So we kind of call that the 20-20 rule. And then getting good quality sleep, avoiding environmental toxins such as cigarette exposure, making sure we try to minimize alcohol consumption, and then eating a healthy, well balanced diet that's full of lean proteins and vegetables. All will help you prevent the development of this very common condition. In terms of treatment, a lot of these principles will still apply. It starts with leading a healthy lifestyle, but a lot of times you're going to need some sort of medication to help intervene and reverse scar tissue. Luckily for us, we now have an FDA approved treatment with resmetirom. It's reserved, for folks living with stage 2 or stage 3 liver fibrosis. And over time, after 1 year of treatment, this medication does have the ability to reverse scar tissue in the liver and to go back to an earlier stage of scarring. And this is incredibly important because it is scar tissue that drives bad outcomes for our patients. So for each stage of scarring you increase, your overall mortality and your liver-related mortality, so your chance of dying from your liver or just in general, goes up for each stage as you progress.
Dr. Stein, thank you very much for an extremely comprehensive overview and answering these questions. And, Brenda, you started off telling us a little bit more about yourself and kind of your involvement in this issue. But how did you first discover that you had MASH, and how would you say it's impacted your life?
I first discovered that I actually had MASH was in 2020. I had gone in for a normal colonoscopy, and the doctor at the time said, "You've got elevated liver enzymes." And I said, "Yeah, yeah, I know. I've been told this for years." And never having known what implications that were with that. And so he said, "No, you need to see a hepatologist. You need to have further testing." And so I went in and had a fiber scan. And at that time, the doctor that I saw told me I was in cirrhosis of the liver. And so she put me on a diet plan, eating really clean vegetables, chicken and fish and turkey, only increasing my activity level. And I was able to go back to fibrosis stage 2. And I maintained that for 4 years. Um, I've kept clean eating, but in April a year ago, I was told that it had advanced to cirrhosis of the liver, and I'm on an open label drug trial. It's the drug that Dr. Stein had mentioned, and I've been taking that. And although my liver still is scarred, and that's not going to reverse as far as I know. All of my numbers have dropped. My ALT and my AST are in the normal range again, and I haven't seen that for years. So um, that's a bonus. But my biggest thing is I would tell anybody who thinks that they have fatty liver disease is to eat clean, get plenty of exercise. It really does make a difference.
What would you say, and you touched on a couple of these, what would you say were some of the warning signs before your diagnosis?
I did have abdominal pain. Um, my digestive tract was not working properly. Um, that's why I went in for colonoscopy thinking that it was something that was related to digestional issues. And it really wasn't. So it was more my liver than anything.
And once you were diagnosed, what maybe kind of break this down a little bit, but what were those
Okay.
initial steps that you decided to take to manage your liver health? And then you've talked about the medications now, but kind of what was the progression of that you said, okay, I'm going to do this, this, and this to make a difference here?
Well, after I was diagnosed with fibrosis, I had moved from the Austin area to Phoenix, and I was seeing a doctor, and in that doctor's office there were multiple posters regarding liver trial studies, and I immediately enrolled in one because I had followed everything that my doctor had told me, and I wasn't getting better. So I thought there's got to be something else out there. And so I went into a blind study for 3 years. No, excuse me, for 2 years. And then I've been in the open label for almost a year now. And, but as far as the steps, it was just staying on top of it. I saw my doctor every 6 months, to just specifically check my liver. Um, so I wanted to make sure that I was aware of the progression, whether or not my liver was holding on its own or whether it was progressing. And for a while, it held. I mean, I didn't really do anything different as far as um, what I was already doing, but I now only shop like the outer areas of a supermarket. I don't go into the canned food, to the processed food. It'll kill you. It really will. And I did increase, I make sure I get a minimum of 10,000 steps a day. And I think those two things have really helped in keeping the progression at a slower pace.
Yeah, it seems, and we're going to get into questions here. We got a ton that we've seen come through, but it seems like a lot of the steps, and Dr. Stein, I'm curious to your thoughts on this as well. A lot of the steps that Brenda talked about taking are a lot of the similar ones that we deal with in obesity, right? We talk about, shopping the outer aisles and not getting the unhealthy foods, but it sounds like there are some parallels there as well.
Yeah, 100%. I mean, I think everything that is, healthy and good for MASH is also going to be good for folks, living with obesity. Again, these two things go hand in hand. And Brenda, congrats on all the choices you're making. The healthy choices are incredibly hard to do. We're creatures of habit, right? We all do the same thing for years and years and years. So undoing that is tremendously hard. And I love hearing your story and that you've been able to do this and be successful. And I hope, and I know your story is going to inspire other people who are listening. So, thank you for sharing that. It's an absolute delight to hear.
Thank you.
Dr. Stein, it's question time. So we're going to dig right in. If somebody watching this is concerned and they think that there could be something, going on with their liver health, what are some of the tests that they could ask their doctor for?
Yeah, so really great question. And, if somebody's worried, so first and foremost, if you have a first degree relative who is living, with fatty liver disease, you should be screened. And the way we screen folks, there are a couple of different tests you can do. Brenda talked about a couple of them in her story. First and foremost, you can have liver enzymes checked, either by your primary care provider or another doctor. And if they're abnormal, you consider referral to a liver specialist. You can also have a fiber scan. A fiber scan is a specialized ultrasound where we take a probe, we put it over the liver, and then we send a sound wave into the liver. And we shake the liver. And when the liver is shooken, we then can determine how much fat is in the liver and then how much scar tissue is there. And there are certain thresholds for which we would want to see you in the office as a liver doctor to make sure that we can get you the care that you need, to get you on the right path, to help you with diet, to help you with exercise, and to determine if medications are something that would benefit you over time, because we don't want your liver to get worse. We want to help you. So there are tests you can have done.
Now that may be a good segue to my next question. You talked about not wanting the liver to get worse. Is MASH reversible?
Yeah, MASH is absolutely reversible. And, over time, there are different ways to do this. One way is actually through weight loss. So if you lose, at least 5% of your body weight, we're going to start to see the inflammation in the liver get better and the MASH to improve. If you want to reverse scarring or fibrosis, you have to lose a little more weight, about 7 to 10%. So that's one thing, and you can do that through any ways, whether it's a different diet approach where you restrict how many calories you take in, or if on the other end you do more physical activity and increase your caloric output. But if you're able to create a caloric deficit and lose weight, that will help your liver to improve and the MASH to go away and the fibrosis to improve over time if you reach those thresholds.
Just to interject for a quick second, because you've talked about some of these steps that people can take, and maybe you were about to go there with this. I was going to, one of the follow-up questions I thought that as the next segue was what's new in the research or treatment options, and maybe you were just about to go there, so forgive me for interrupting.
Oh, no worries. That's okay. So, but yeah, I was going to talk about a couple of things. If you lose weight, through medications, that can also help, improve MASH and reverse liver fibrosis. So, some of the newer weight loss, medications that work through GLP-1, Ozempic, Wegovy, tirzepatide. If you achieve weight loss at those thresholds, the liver will certainly get healthier. The other thing too is, again, we now have an FDA approved treatment which reverses liver fibrosis and also improves MASH activity. We've talked a little bit about this, but that is resmetirom. It actually works through thyroid hormone receptor beta targets on the liver, and through operating that way will help to reverse scar tissue after 1 year of treatment in nearly 2 out of 5 people who take the medication.
Well, excellent. And it sounds like, and I was like being hopeful in these situations, but it sounds like there are a lot of things coming down the pipeline, especially even for our members who may be dealing with obesity and can potentially be impacted by MASH, that there are treatments that are available. There's continued research that's being done. So there is hope on the horizon, I would say.
Yeah, 100%. I mean, if you're living with MASLD and MASH, this is a great time to have it, which seems kind of weird to say, but we didn't have any really great options for folks for so long. It's really nice to sit one-on-one with a patient and tell them we now have something that is FDA approved. We expect another medication to likely be approved by the end of the year. Called semaglutide, which again works the same way as the Ozempics and the Wegovy, just at a different dose. And then if you look at medications, being studied in various phases of clinical trials, there are many, many promising, targets which are showing both improvement in MASH and then also reversal of liver fibrosis. And there's something Brenda had said earlier, historically, we didn't think we could actually take cirrhosis and make it get better and go back to an earlier stage of fibrosis when we look at a biopsy before and after treatment. But some of the new medications in middle to late phase clinical trials are finally showing the ability to reverse cirrhosis back to an earlier stage. So there's definitely, hope now. There's more hope on the horizon. And I really think, we're on our way to making an impact, in this tremendous public health problem where 1 out of 2 people are going to be living, with fatty liver disease by the year 2030.
Thank you, Dr. Stein. And Brenda, we've got some questions here for you as well. So first up, what lifestyle changes made the biggest impact for you?
A lot had to do with what I was eating. I grew up in the South, and in the South, everything was like fried or with a gravy, or so it was making better food choices, I think, was my largest factor. Um, Incorporating more lean protein. I'll specifically say I came from Texas, and we were a beef state, and so we had beef on the table probably 5 to 6 times out of every week. So it's really being more conscious about what I'm taking in, and the effects. And I can tell when I've eaten something I shouldn't, my body feels totally different now. And so I would think that would be the biggest factor for me.
What advice would you have for someone who's newly diagnosed?
Follow up, ask questions, do your research, because I think oftentimes we just go with what our doctors say. And 30 years ago, if I would have done more research about what elevated liver enzymes were and what could be the factor. I was tested for hepatitis. My doctors frequently ask me, was I a drinker? And I'm not a drinker. I'm pretty much a teetotaler. So I needed to have done more research for myself. I needed to be a better advocate for myself. And I would tell anyone who is recently diagnosed or suspects to advocate for themselves, do the research, ask as many questions as you can. And if you're not happy with one answer, go for another. Go to different doctors. And you need the best advice you can get.
Fair enough. And so this question, last question, I'm going to put it out to the both of you. Brenda, I'll go to you first. What's one common misconception about MASH that you would like to clear up?
That I can totally control it, because you can't. I have metabolic syndrome, and that's really hard to lose weight. I did everything my doctors ask. Sometimes it's just not enough.
Dr.
So,
Stein, what would you say?
I would echo what Brenda said. I mean, I think it's removing the stigma around the disease. There is the pervasive thought that says it's the individual's fault. It's your fault why this happened to you. You did this to yourself, and we know that is completely incorrect, right? We know there's genetic predisposition. We know there are folks that, based on their genetics, they're going to respond less to diet and exercise. They may respond less to medications. We don't know that quite yet, but we're looking, into that. And then there are environmental factors, right? I mean, food portion sizes are 3 times bigger than they were in the 1980s. So, we have this environment, and then we also have a society that sets us up for failure, where we're not prioritizing, health and allowing people to have the time they need to take care of themselves, or even the resources to access, healthy options. So, again, it's a lot of factors outside the control of the person living, with MASH, and moving beyond something that's punitive and pointing the finger is really important if we're going to make, a dent in this public health, problem. And nobody wants the finger pointed at them. People feel, bad enough if you ask, patients, how they feel about their diagnosis. I've had patients, take years to tell their patients, or to tell their family, excuse me, because they were worried about some of the judgment and the negative connotations, and really just working to remove this. And part of this was changing the name of the disease. We don't call it NASH anymore, or NAFLD. We remove the words, non-alcoholic, remove the words fatty, to help kind of take away some of the stigma with this condition, in a way to, be more sensitive and holistic in our approach.
Dr. Stein, I love that you brought up that stigma side of it, because that is something that we focus on so much in obesity. And thank you both. That brings us to the end of today's event. A big thank you to you, Dr. Stein and Brenda, for sharing your insights and lived experience. And to everyone watching, for your questions and participation. Looking back on this discussion today, here are some of the key takeaways that we have. Number one, MASH and obesity are deeply connected, but early detection can make a real difference. Ask your doctor about non-invasive liver tests. Lifestyle changes and treatments are available and improving all the time. If you live with obesity, talk to your doctor about your liver health. And please check out OAC's Health Talk on liver health as well, and visit our resources page for helpful tools, clinical trial information, and more at the link below. Be sure to like and follow the OAC for future episodes and educational opportunities. Dr. Stein, Brenda, thank you so much again for your time today. It's been a pleasure doing today's episode with you.
thank you.
Thanks so much for having me. It was absolutely delightful.
Take care.